Welcome everyone, and again I'd just like to thank Dr. Chasen for the brief introduction, and I would like to thank the CCSRC for the opportunity today to present during today's webinar. And I'm looking forward to discussing the current evidence on the cancer survivorship experience during the COVID-19 pandemic, and specifically the impact of the pandemic on cancer survivors. So I will be proceeding with this presentation by first orienting the group to survivorship care now in the context of the evolving healthcare delivery landscape during the COVID-19 pandemic. And then I will move into a discussion of the current and developing literature on the impact of the COVID-19 pandemic on cancer survivors. So the objectives of today's webinar are threefold, and the first objective is to communicate the preliminary evidence on the impact of the COVID-19 pandemic on cancer survivors based on the current literature. Our second goal is to highlight the need for more rigorously designed research initiatives to elucidate the impact of the pandemic on cancer survivors. And the final objective of this webinar is to promote discussion on identifying and addressing potential direct or indirect consequences of the pandemic on cancer survivors. So we'll start off by situating ourselves. We currently are living through the COVID-19 pandemic, and the COVID-19 pandemic caused by SARS-CoV-2 was first detected in Wuhan, China in December 2019. And it quickly escalated to levels that required the World Health Organization to declare a pandemic by March 2020. And we know that in a matter of months, this global pandemic has severely impacted healthcare service delivery across the world. So in specific, healthcare services associated with non-communicable diseases have been disproportionately and significantly disrupted. And in fact, a survey of 155 countries conducted by the WHO found that 42% of countries reported disruptions to cancer treatment, and an astounding 63% reported that there had been service disruptions in rehabilitative services, which include survivorship care in some countries. So it's evident that the impact of COVID-19 extends far beyond that of an infectious disease. The emergence of this pandemic has resulted in radical changes in global healthcare delivery and has had practical repercussions for cancer survivors as essential components of their care, including ongoing screening and surveillance, physical symptom support, and psychosocial symptom support that have traditionally been heavily dependent on in-person healthcare interactions now have required modifications or postponement or cancellation. So the current circumstances have reduced accessibility of some services that are already limited in terms of support during a time when anxiety, depression, and COVID-19 related fears appear to have increased among survivors. And we know that new social distancing requirements that have been imposed by governments based on evidence-based international recommendations and the deferral of non-emergent, elective, and preventative medical services have detrimentally impacted the state of survivorship care. And in fact, survivorship visits have been placed at lowest priority in some countries, despite the fact that experts have stressed the importance of maintaining the emotional well-being of patients through psychosocial support during the pandemic. And this has required many survivors that previously benefited from significant support and guidance from healthcare professionals and experts to try to self-manage symptoms for which they previously may have received varying levels of support. And consequently, cancer survivors in this scenario may feel helpless and neglected as their unique needs are being classified as non-urgent and may not be addressed in the right place at the right time, in the right amount, and in the right manner. So experts have indicated that such circumstances will detrimentally impact the survivorship experience and the management of cancer-related symptoms, quality of life, and survival. So it's important to also look at real survivor experiences that we are able to see to date. Anecdotal survivor experiences included in the current and developing literature on the topic have already begun to illuminate the untold toll of the pandemic on patients without COVID-19, and this includes cancer survivors. So you can see here just the beginning header of the article by Dr. Lisa Rosenbaum, and that has been published in the New England Journal of Medicine. And she shares the experience of a patient identified as Miss D, a 51-year-old breast cancer survivor recovering from a bilateral mastectomy during the pandemic. And Miss D expresses about her experience living through COVID-19, in addition to being a cancer survivor, recovering from this mastectomy. And she notes that for her, and cancer is so emotionally loaded, you need some love. The human part is falling by the wayside. So this is the way that she felt her experience had been going with COVID-19 and her recovery. So anecdotal information from survivors indicate that they generally value the opportunity to learn about social and emotional support services following active cancer treatment. However, the current situation has necessitated brief interactions over the phone in some situations, and this has left some survivors, and I quote, feeling overwhelmed and confused. And again, I quote, that the lack of face-to-face interaction compounded by the unavailability of typical support systems has made it difficult to cope. So you can see that these survivor experiences provide a very clear visual for what people are going through as they are going through these very significant life events concurrently at the same time. So in order to basically begin to understand the impact of COVID-19 on cancer survivors, relevant articles that address the impact of the COVID-19 pandemic were identified through a systematic search of appropriate databases. And the study that we have undertaken was developed in accordance with PRISMA protocols, and a narrative synthesis of all eligible studies was conducted, and that is exactly what I will be sharing with you today. So 19 relevant articles were identified on the topic, and just for some brief information, the search was completed up to August 27, 2020. It is my understanding that there has been a little bit more literature, a few more articles added to the literature, and that is something that we will be looking at going forward. And of the 19 articles that were identified on the topic as of August 27, 2020, 12 were expert opinions, which included editorials, calls to action, as well as clinical correspondence. In addition to the expert opinion articles, there were also 2 literature reviews, 2 prospective cohort studies, a retrospective cohort study, a descriptive study, and a pooled meta-analysis. And it's important to note here that most of the selected articles, and in fact 63% to be exact, depend on expert opinions presented in various forms, and that these explore specific aspects of the impact of the pandemic on cancer survivors, and very few actually examine the potential wide-ranging impacts of COVID-19 in any great detail so far. So overall, however, the articles that have been identified that are relevant to this topic, of those, 16 of the articles do comment on the impact of the COVID-19 pandemic on the physical well-being of cancer survivors, and 15 address the impact of the pandemic on psychosocial well-being, and 3 highlight the economic consequences of the COVID-19 pandemic related to the financial well-being of survivors. And it's important that we also note where this research is being conducted. And you can see from this pie chart here that the identified articles are from the US, Hong Kong, Canada, Australia, China, Sri Lanka, and 4 are the result of multinational collaborations, of which 2 are a collaboration between the US and Canada. And The current evidence that we have may be categorized based on specific content areas related to the impact of the COVID-19 pandemic on cancer survivors. And some of the articles address multiple categories, in fact. So the first category is comprised of literature that addresses significant changes to the care that survivors receive and the channels through which it is actually delivered. And some evidence is available on how survivorship care has evolved in response to the new challenges presented by the COVID-19 pandemic. So foremost, Calvillo, Arguelles et al. And Dietz et al., they point out that the current recommendation based on available evidence is the temporary modification or postponement of routine surveillance and follow-up of asymptomatic cancer survivors to reduce risk of COVID-19 transmission through in-person health encounters. And specifically, if we look at Dietz et al., they have worked on allocating priority classifications to breast cancer patients and have placed routine follow-up, survivorship visits, and screening in priority group C, which entails remote visits only or follow-up postponement. Next, we see Chan et al. And Kozwara, and they have indicated on this topic that survivors have seen significant delays and cancellations of follow-up appointments and the replacement of most in-person interactions with telehealth. However, Chan et al. Have also noted the fact that many barriers continue to exist and impede the widespread implementation of telehealth. And in fact, great disparities exist in how patients' needs are being triaged amid the pandemic through these channels. In addition, Ratnasekara et al. Have also highlighted that lockdown restrictions imposed due to COVID-19 have impacted the availability and accessibility of routine healthcare services for cancer patients and survivors in Sri Lanka. And if we look at the next slide, we see that Papowski and Hamlich conducted a survey of breast cancer survivors in which they found that 44% of survivors reported delays across all aspects of their cancer care and treatment. So the final group of studies that look at survivorship care delivery include Flanagan et al., Javeri et al., and Nilsson et al., and they have demonstrated how the pandemic has necessitated drastic changes in the delivery of some cancer survivorship experiences, and they highlight sort of the changes that have occurred, the way their programs have changed and evolved. And while there has been an effort to rapidly transition to delivering elements of survivorship care, including physical activity, nutritional support, stress management, and spiritual wellness through telehealth, some elements of operations have been temporarily suspended, postponed, or removed by necessity because they simply cannot be delivered through an online or virtual manner. And as such, the COVID-19 pandemic has drastically reduced the frequency and the types of care survivors are able to access as jurisdictions attempt to reduce the risk of COVID-19 transmission. And now if we look collectively at the research that we have that highlights or points out changes in survivorship care delivery, the available literature provides preliminary information regarding drastic changes to survivorship care services that are accessible to survivors, as well as the channels through which they are delivered during the pandemic. And survivors have been subject to significant delays and cancellations of follow-up appointments and the rapid transition of in-person healthcare interactions to telehealth. In settings that actually permit its widespread implementation. As such, the pandemic has affected the availability and accessibility of routine healthcare services, particularly physical examinations and some elements of survivorship care, including guided exercise programs, which cannot be effectively delivered remotely and have been temporarily suspended, postponed, or removed from survivorship care plans. As efforts are made to reduce the risk of COVID-19 transmission, there have been many significant changes to the normal standard of care that some survivors have grown to depend on in terms of the frequency, types of care, as well as the modes of delivery. And it's important to note here that any changes to a trusted source of care, which may have previously been perceived by the survivors and their support systems as a source of confidence and stability, may actually now become a source of increased distress and anxiety that needs to be addressed or to be identified. So the second group includes literature that comments on the impact of the pandemic on the psychosocial and physical well-being of cancer survivors. And Boakai et al. And Huang et al. Noted that postponement of surveillance and other elective procedures aimed at improving the quality of life of survivors may actually lead to increased anxiety, delayed diagnosis of disease recurrence, as well as reduced quality of life. In addition to these articles, Chan et al. Indicated that some healthcare providers have begun to note increased anxiety as well as distress among survivors in relation to using telehealth. And Javeri et al. Noted that some survivors have actually expressed an increased need for behavioral health and social support during the pandemic. Nekliadov et al. Highlighted that the pandemic may disproportionately impact the physical and psychosocial well-being of cancer survivors due to the requirement to maintain physical distancing from social and support networks and increased anxiety related to cancellation, postponement, or modification of follow-up visits and cancer surveillance. Very notably in this article here by Ng et al., it found that cancer survivors demonstrated greater catastrophizing and health anxiety compared to healthy controls. However, they did demonstrate less psychological distress compared to healthy controls in the setting of COVID-19 based on this study. On the other hand, however, according to Kozwara, cancer survivors experience greater psychological distress and difficulty managing physical symptoms than the general public, and that they may be unable to continue to adhere to lifestyle recommendations due to the restrictions imposed by the pandemic that have limited physical examinations and have required survivors to self-administer exercise programs that previously would have been delivered by healthcare professionals. And furthermore, Ratna Sikra et al. Noted that oral cancer survivors experiencing pain and difficulty swallowing face difficulties in accessing routine treatment and medication due to the lockdown restrictions that were placed in Sri Lanka. And Chung et al. Found in this article here, they highlighted the experience of some pediatric cancer survivors in Hong Kong that were perceived to have to be more susceptible to COVID-19 infection. And these survivors, these pediatric cancer survivors, in fact, some of them found themselves confined to their homes, which was noted as being a potential may potentially result in downstream adverse health outcomes as well as poor psychological well-being. So Young et al. Pointed out that cancer survivors also may have difficulty determining whether their experienced symptoms are the result of COVID-19 or due to cancer recurrence, and whether they are permitted or in the right to report them to healthcare providers. In addition, a very interesting study actually by Zhu et al. Noted actually reduced insomnia severity among young adult cancer survivors following COVID-19 lockdown restrictions. And basically they highlighted from their findings the need to identify factors contributing to better sleep, in addition to increased anxiety and depression during the pandemic that had been noted among this population. So in addition to the studies that have previously been highlighted, a subset of the included articles provided preliminary results indicating that cancer patients and survivors may be more susceptible to COVID-19 infection. And in fact, Liang et al. Noted that cancer patients and survivors with current or past cancer diagnoses may be at increased risk of significant morbidity, including, but not limited to, ICU admission, the requirement for invasive ventilation, or even death in some cases, compared to patients without cancer. In addition to this study, a pooled meta-analysis by Desai et al. Also found that patients with cancer and cancer survivors were at increased risk of acquiring COVID-19. And as such, although evidence regarding the association between COVID-19 and cancer remains unclear to this day, based on the potential increased susceptibility of cancer survivors to COVID-19, they concluded that the necessity of any healthcare interventions must be weighed against the risk of inadvertent exposure to COVID-19. So now if we collectively look at the findings of the articles that I have mentioned to this point, it is evident that the preliminary research indicates that cancer patients and survivors may have increased susceptibility to COVID-19 infection. And in an attempt to protect cancer survivors and due to the redirection of healthcare resources in some settings, cancer surveillance and other elements of survivorship care have been postponed, or in some cases even canceled. And this may result in increased anxiety, diminished quality of life, and delayed diagnosis of any disease recurrence or secondary malignancies. And the available literature actually also highlights that increased anxiety and distress has been observed among some survivors with respect to accessing telehealth services. And they hold doubts related to the quality of care available through the remote medium in some cases. In addition to this, the strict social distancing restrictions that have been imposed in some jurisdictions have also reduced access to social and support networks that some survivors may have previously depended upon for physical as well as psychosocial support. And the preliminary research also indicates that cancer survivors are prone to catastrophizing as well as health anxiety in relation to COVID-19 when compared to healthy controls. Thus, we can see from the limited literature that is currently available, it gives us initial indications that the COVID-19 pandemic may detrimentally affect the psychosocial and physical well-being of some survivors. And furthermore, we will conclude by looking at financial well-being. So the available literature notes that the COVID-19 pandemic may disproportionately impact cancer survivors from an economic standpoint as well. So we see in fact, four articles that discuss this to varying degrees and in some amount, and those were Badur et al., Boakai et al., Neklyudov et al., as well as Kozwara. And all of these articles, they comment on the potential financial consequences of the pandemic on cancer survivors. And the pandemic has significantly, as we know, impacted national economies and has resulted in widespread unemployment. However, some cancer survivors with the option to continue to work during the pandemic may have had to leave work due to immunocompromised status, which placed them at increased risk of COVID-19 infection compared to their peers. And survivors that have lost their jobs due to the pandemic may be experiencing greater economic burden compared to the general population due to the cost they incurred during their treatment and as part of the recovery process they had to go through. So the increased financial hardships that we note may in turn cycle back and result in detrimental downstream psychosocial and physical impacts on survivors related to their overall health-related quality of life, as well as mortality. So currently, there is very limited definitive or conclusive evidence regarding the impact of the COVID-19 pandemic on cancer survivors. And overall, the presently available literature provides preliminary indications of wide-ranging impacts of the pandemic on cancer survivors with respect to the requirement to adapt to new means of healthcare delivery, as well as their physical, psychosocial, and economic well-being. So the COVID-19 pandemic has now left survivors dealing with the consequences of rigorous cancer treatment in the context of the new challenges they are now facing related to social isolation, financial hardship, and uncertainty with respect to their ongoing care. And these challenges now presented by the global pandemic may disproportionately impact the overall well-being of cancer survivors and may result in unintended long-term consequences that are yet to be revealed. So before we conclude, it is also essential that we highlight the limitations of the study at hand. And a key limitation based on the nature of the study that we have conducted is that we were restricted to articles published following the initial detection of SARS-CoV-2. And given the limited time frame under consideration and the significant resource demands imposed by the COVID-19 pandemic, very limited, rigorously designed studies are currently available on the impact of the pandemic on cancer survivors. And in fact, this exploration was heavily dependent upon various forms of expert opinion articles and preliminary studies that highlight some of the potential short-term impacts of the pandemic on survivors. And in addition to that, it's important to note that due to the limited literature currently available, a critical appraisal of available evidence could not be conducted. I would like to also highlight some future directions that we have proposed for researchers, healthcare providers, as well as policymakers. And this includes undertaking further rigorously designed research initiatives to elucidate the impact of the pandemic on cancer survivors. And alongside this, much more attention and resources are required and must be allocated in order to identify and address potential direct or indirect consequences of the COVID-19 pandemic on cancer survivors. And at this point, I'd like to thank everyone for taking time out of your very busy schedules to attend today's webinar, which explored the current evidence on the cancer survivorship experience during the COVID-19 pandemic. And I believe we now have some time for discussion, and this is a great opportunity for many of our participants today to share their personal experiences dealing with COVID-19 and dealing with cancer survivors at the same time. And I would be very much interested in hearing those experiences and whether what you have heard today is similar to your experience, different, or if you have something to add. And if you have any questions following the completion of this webinar, you can get in touch with myself or Dr. Chasen at the emails that have been listed on the slide. And again, I'd like to thank everyone.